have prepared the following summary regarding access to essential drugs. And we will start saying that millions of adults and children suffer some diseases like cancer, AIDS, and 80% of these people who have pain live in Latin America with low to medium income, with inexistent access to healthcare. Because of the lack of services, they account for more than 80%, where they don't have basically oral morphine. They also spoke about the impact that this has in the quality of life. For Bolivia, it's a dignified life, and there is a license for tutors that has been mentioned as well, which is 100% paid on serious diseases, and it has also an impact in the quality of death. There were some proposals with regards to improving knowledge for the management of moderate to severe pain. And Argentina mentioned and showed educational programs that are imparted online, which will avoid its misuse and putting the population at risk for not being able to prescribe well. What about the laws? There are restrictive laws, and there is also an issue on the regulation. This issue on regulation was very well expressed by El Salvador on the availability of access from the regulating agency, where they showed us the electronic prescription that will be linked to a health registry, location of the pharmacies availability, and the lists of controlled substances, together with a comment by Brazil, where they are pushing for the analysis of the priority laws and regulations and also prices. Regarding the prices, the essential packages that were mentioned, which are around $3 per capita. And here, once again, Argentina mentioned something about the drop on the cost of morphine compared to the situation of ibuprofen. The idea here is to avoid the lack of availability. Well, I don't know, Jaime, if you have something to add. Dr. Allende, of course, is an expert. Before giving this summary and sharing this summary, unlike you, I'm not a health professional. I'm an economist, and to raise prejudice even more, I'm a deputy. However, I think I'm a good person. And one of the reasons which makes me be here today is that in my country now, we are discussing different things. One of them has to do with palliative care. I'm a member of the Health Commission as well. And something that we have tackled here, and I would like to thank Dr. Pastrana, is that palliative care is a person-centered policy, and it is the best decision for the use of public resources, as has been presented by Dr. Herrera. This package of palliative care has to contain the access to medicines, but also access to qualified staff. And in terms of the drugs, as Silvia said, there are programs which stem from pain. Then they jumped to cancer, and now they are related to the non-oncological situations. They have to be effective. Their cost effectiveness has to be depicted, and also the example of El Salvador is using technology for this accessibility, even being geo-referenced, so traceability both of the physician and the patient, and oversight with a statement which is important, and not because there's oversight, barriers have to be implemented to these drugs. And now regarding the prices, Argentina gave an example. There's an explicit guarantee for oncological patients who have free access. And one way of guaranteeing this is through a law on palliative care, with a specific allocation of public resources to have access to drugs by way of a trained group of people. And just to finish, I know that many of you, I have heard you say that you have signed all over again many declarations and that you feel that nothing has happened. I want to tell you that you're wrong. There are lots of things which have occurred, because for those of us who are not part of the medicine world, I'm a frustrated physician. My sister, she's a doctor. I'm an economist. She works at Mayo Clinic, and we always discuss these topics. A level of consistency, a coherence of your discourse, which is shown at this seminar, makes Latin America to have policies which are consistent in different countries. So I'm leaving with homework to ask the Ministry of Health and also the National Congress to have a palliative care law that is universal, not only for oncological treatment, but also for non-oncological. Thank you very much.